This is a recording for the occupational English test. So the test is held in the Dr. BKM Institute. The candidate name is Kishori Sharma and candidate number is 2. The interviewers are Kiran and my interrogator number is 1234. Okay. So the profession is nursing. Good afternoon. My name is Kiran. Can you please state your full name?
My full name is Kishori Sharma.
Okay. Great. You are taking the test for nursing. Is that correct?
Yes, ma'am.
Great. Thank you. Can I see your ID, please?
Yeah, sure, ma'am. Here it is.
Thank you. So I'm going to working with you for this test. There will be warm-up questions followed by 2 role plays. Remember that this is a test of your English, not your professional knowledge. So please speak naturally. Do you have any questions about this?
No, ma'am.
Okay. The warm-up questions are not assessed. It's a chance for us to get used to each other's voices. So we will just talk for 2 to 3 minutes. So I would like you to tell me about your professional background. So why did you decide to become a nurse?
Well, ma'am, I am a registered nurse and working in the Manipal hospitals right now and also preparing for the abroad job immigration. But I enrolled in this profession just 2 years ago and I never thought about to enroll in this, but I always wanted to become a doctor. But just some lack of information and so many causes are there, so that's why I enrolled in the nursing profession. But now I am grateful that I made this decision. This is the best decision of my life and I am grateful to become a nurse right now.
Okay, that sounds good. And what kind of a person makes a good nurse?
Well, there are so many qualities a nurse should have, but I will encourage that the nurse should have a good quality of listening, and empathy is the main thing that nurse should have, and he should be a good communicator, and these are the things a nurse should have, I will say.
Alright. And what's the best thing about your work?
The work is quite good because I am working in the endoscopy department. I never thought to enroll in the endoscopy department, but the best thing about that is I am learning endoscopy procedures and assisting in the IV medications also. And there are so many learnings here I am getting to know. So these are the things.
Thank you. Let's move on to the role play now. So I'll take the part of a patient or perhaps a relative. You will take the professional role. So each role play will last for 5 minutes. And the purpose of role play is to get evidence of your ability to communicate effectively with the patient. Use your ability to fulfill as much as of the role play as possible. Do you have any questions?
No, ma'am.
Okay. So this is your role play card.
Okay.
So you are having 3 minutes to prepare the first role play. You will start the role play after the time you will know when 3 minutes are up. You can ask me if there is anything you are not sure about and make notes on the role play card if you want. There is a pencil for making notes. You can look at the card during the test but must return it to me at the end of test. So this is the information for the first role play and the role play number 1 for the profession of nursing. So please start preparing now. Okay, your time is up. Now role play will last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play card now?
Yes, ma'am. Good morning.
Good morning.
I am Kishori Sharma, one of the registered nurses working in this emergency department. I am here to insert an IV cannula to your child. Do you have any concern or question about this?
Yes, nurse. I don't understand why my daughter can't have lots of drinks instead of having intravenous fluids.
I totally understand your concern. Being a parent, you might be stressful about this. But I would like to reassure you that IV fluids insertion through the cannula has more effectiveness than the oral fluid administration. Because your daughter is unable to take oral fluids right now. And another thing is that IV cannula insertion will be helpful to IV administration of medicines and fluids that will go directly into the bloodstream, and it will help to regain the hydration more effectively and as soon as possible. Am I clear to you?
Yes, nurse. The reason for the cannula is clear now. But I am concerned that having the cannula inserted will be painful for my daughter.
I totally understand your concern. I would like to reassure you that the procedure is not the painful procedure, and your daughter will feel pain for a once only, and that is not for the long term, okay? So, in the starting of the procedure, we will provide the numbing cream on the hand of the baby. So, it will numb the area and she might not be feeling any kind of pain, okay? After that, we will insert the cannula and the pain will be for once. And after that, we can start the procedure and we can administer the IV fluids after that. For the security, we will fix the IV derm, like the fixer on the IV cannula also. That will be fixed for the long term and help to gain the dehydration through the IV cannula. Anything else you want to ask?
Yes, nurse. Actually, my daughter hates injections, so she's going to panic when she sees the needle.
I understand. I would like to say that your daughter will be cooperate if you are providing some strategies. So we can follow that the strategies like to reduce his panics and anxiety. We can distract her, like saying about his favorite foods and favorite games. Like we can talk about anything with her, and we can explain the steps of the procedure. So she might it might helpful to reduce the anxiety of the baby. And another thing, to reduce the anxiety, deep breathing is a very helpful thing. So we can advise her to do that. And these are the things we will follow and it will really help to reduce her anxiety. And we can do that. Am I clear to you?
Yes, nurse, you're clear.
Okay. So, and the treatment, we will firstly, I will provide the IV cannula bolus right now. And after that, I will reassess the IV cannula for after 4 hours to check the possibility of further fluids are required or not. Okay?
Okay, nurse.
Okay, so these are the things we will follow. And anything else you want to ask?
No, nurse.
Okay. So there is a possibility to stay the baby overnight in the hospital. We will start the IV fluids and regain the hydration, but it can be possible we can admit the baby in the hospital. So it will help to proceed with the further treatment. Okay.
But nurse, my daughter has not been in a hospital overnight before.
I understand, but we can admit for the better treatment and better hydration. Don't worry, you will be with the baby because we will admit baby to the ward only, and you can stay with her in that department also. So it's with having you with her, so she might not feel any anxiety, and it will be really helpful for her. So are you ready to admit your baby?
Yes, nurse. It sounds good that if I can stay with my daughter after she has been admitted, so then she can stay here.
Yes, I thank you for choosing admission for the baby because it will really help for the further management and the assessment. So here is the consent. You can consent the sign, and we can admit the baby for the further procedure. And IV cannula procedure. This consent is for the IV cannula, and you can sign it, and I can start the procedure after the onwards.
Okay, nurse. I'm agreeing for my daughter to having a cannula inserted.
Okay. So I am going to prepare the IV insertion equipment. So for that time you can stay with the baby and you can reassure her. And there is nothing to be worried about because after the procedure she will be getting fine, and if admission is required we will admit her also. So these are the things we will follow. Anything else you want to ask? I hope I've cleared all your doubts.
Yes, nurse. Your information is clear to me.
Okay, so here is a buzzer also in the right side of the bed. You can bell this, and I will be here for your assistance. And if you will have any query, you can ask me anytime after pressing the buzzer, and I will prepare the equipment here. And if still you have any query, you can ask me anytime. I will here over the counter, and you can ask anything. So these are the things we have did. So anything else? Okay, thank you.
Okay, yes, I'm in that.